Hello, my name is Lori Fuller, and I'd like to welcome everyone to the overview of the Family Urgent Response System, also known as FURSZ, training webinar. Today's presenters will be Jessica Haspel from Children Now, and then myself, Lori Fuller, Jennifer Snar, Ricky House, and Colin Williams, all from CDSS. To get started, we're going to talk a little bit about today's training objectives. By the end of the training, participants will be able to describe the various components of the FURSZ program, including the history, state and local components, intent, and some key definitions. You should also be able to identify the roles and responsibilities of the statewide hotline, describe the procedure of the warm handoff process, and recognize the unique definitions of urgent and non-urgent responses. Additionally, participants should be able to understand the procedure of follow-up by the statewide hotline, identify the roles and responsibilities of the mobile response systems, including their team composition, trauma-informed practice, in-home support, follow-up, and coordination. At the end of the presentation, participants will be able to complete the FURSZ summary report and understand the data requirements of the FURSZ program, including the collection requirements, collection process, and the exchange of the data between the counties and state. Additionally, you'll be able to prepare and participate in program outreach utilizing the provided materials and hear about some local dissemination strategies and how to incorporate key messages as you talk to families about the FURSZ program. And lastly, you'll be able to identify and locate the additional guidance and resources for the FURSZ program. Now I'm going to turn it over to Jessica, who's going to tell us a little bit more about what the FURSZ program is. Jessica?
Thank you, Lori. Yes, I will be talking a little bit about the key background about FURSZ in terms of what is FURSZ, its history, and the intent behind FURSZ. On this slide, you'll see the definition for the Family Urgent Response System that is in statute. I'm going to take a moment to read it because the actual language and definition provides some important context when thinking through what FURSZ is and how to achieve its goals. The Family Urgent Response System means a coordinated, statewide, regional, and county level system designed to provide collaborative and timely state-level phone-based response and county-level in-home, in-person mobile response during situations of instability for the purposes of preserving the relationship of the caregiver and the child or youth, providing developmentally appropriate relationship conflict management and resolution skills, stabilizing the living situation, mitigating the distress of the caregiver or child or youth, connecting the caregiver and child or youth to the existing array of local services, and promoting a healthy and healing environment for children, youth, and families. I'll be talking more in depth about the intent and goals of FURSZ in a few moments, which are reflective of the FURSZ definition, but do want to highlight early on the emphasis on FURSZ being a coordinated state and local system, and that it has broad aims that include a focus on healing, stabilization, preserving relationships, and connecting to ongoing supports in the community. It's also helpful to hear a little bit about the history of FURSZ before we get into the intent. The FURSZ proposal was developed by a very broad cross-system coalition of stakeholders that included child welfare and behavioral health stakeholders, as well as stakeholders that will benefit directly from this resource. We heard a lot of feedback in designing it from caregivers and youth and what they felt would be a helpful resource. The Family Urgent Response System was enacted in 2019, and since that time, there's been extensive implementation planning that has been underway for FURSZ to launch on March 1st, 2021. Also included on this slide is some additional information as far as the California Welfare and Institutions Code sections that provide further detail on FURS should anyone want to look at the statutory language. FURS consists of two key components. One is the 24/7 statewide hotline to respond to caregivers or youth during situations of instability. And the second component being county-based mobile response systems that are available 24/7. During the FURS development process, stakeholders identified the importance of both of these two components, one having this central place or number for youth or caregivers to turn to for help in critical moments, paired with the in-person local support on a 24/7, 365-day-a-year basis. CDSS will be talking about each of these components in much more depth later in this training. Understanding the intent behind FURS is necessary to ensuring it is successfully implemented to achieve its goals and best support children, youth, and caregivers. FURS was intended to build upon and address a critical need identified during the Continuum of Care reform implementation. During CCR implementation, the lack of immediate trauma-informed support during critical moments was identified as a huge barrier to ensuring stable, nurturing, family-based placements. And the need for FURS that was identified through CCR implementation is even greater now, given the severe anxiety and stress placed on children, youth, and their caregivers amidst the COVID-19 pandemic. FURS is intended to provide current and former foster youth and their caregivers with immediate trauma-informed support when they need it on a 24/7 basis. This truly closes the gap for families that have experienced conflict and didn't previously have anywhere to turn or had inadequate options for trauma-informed alternatives to calling 911 or law enforcement. It's really important to keep in mind that FURS is a completely new trauma-informed resource to fill gaps that exist statewide. It was established to ensure that the immediate support that I talked about just a moment ago is available in a consistent and coordinated manner, rather than dependent on meeting eligibility criteria that may differ based on geography, capacity, provider, or contracting limitations. As we all know, resources available in each of the 58 counties differ vastly, and even when resources exist, there are variations in who is served or when the resource is available. As a result, children, youth, and caregivers often have trouble finding the support they need at the point in time when they most need it. They often don't know who to contact during these critical moments, or are sometimes turned away because their situation does not rise to a certain level of urgency or emergency, or otherwise fit within the resource's eligibility criteria. FURS fills this gap by providing a central place for children, youth, and their caregivers to contact in order to receive the immediate phone support as well as in-person support. It truly is a new resource and should not be looked at as business as usual. FURS is intended to be a cross-sector coordinated response system and break down silos. This is really important to keep in mind because oftentimes issues are labeled as this is a mental health issue or this is a child welfare issue, and they're sort of pushed into certain silos as a result. And FURS was created in order to break down those silos and to truly look at when does a family need support and how do we get it to them in a coordinated way. A key component of that is allowing youth and caregivers to define when they need the immediate support. This is in contrast to many existing resources where a professional is deciding when the family qualifies for help, and issues often have to reach a crisis or emergency level before the youth or family is able to get the support that they're telling us that they need. FURS is very much supposed to be a family and youth friendly resource that listens to what they tell us they are needing. It is also designed to address a continuum of situations of instability that include but are not limited to mental health crises. I'll be talking about the definitions in statute in a minute, but I want to highlight here that instability for purposes of FURS is defined broadly to include situations involving tension and conflict, and does not require the youth to be a presenting problem or that a mental health issue is present. This is really important because youth have often said that they feel that in order to get a resource or support, that they're often viewed as the actual problem or the one that there's a need for. And FURS is very much looking at the family as a whole and trying to help and provide support when there is a conflict, when there's a crisis, and not coming at it from the standpoint that the youth themselves is the problem that is needing to be solved. The other thing to highlight just around that is the importance of having a broad continuum of circumstances that FURS is available to provide support during is important in order to early on prevent conflicts from escalating and leading to crisis or disruption in the relationship between the child or youth and their caregiver, as well as during things that are traditional mental health crises. As you can see from this slide, the goals of FURS are broad. They include preventing placement disruptions and maintaining children and youth in their current living situations, preventing the need for 911 calls or law enforcement contacts, and the needless criminalization of traumatized youth. Achieving this particular goal of reducing law enforcement contacts is really critical to improving outcomes for children and youth, especially children and youth of color, who are disproportionately negatively impacted by both the child welfare and juvenile justice systems. Another goal of FURS is to prevent hospitalization and placement into congregate care, and to reduce the rate of reentry of former foster youth back into out-of-home care by providing the support they need to stabilize their living situations. Some additional goals of FURS are to improve child and family outcomes, improve trust, and preserve the relationship between the child or youth and their caregiver, promote healing as a family, improve retention of current foster caregivers, promote stability for youth in foster care, including youth in extended foster care, and connect families to ongoing resources in their community. As to this last goal of connecting families, we want to emphasize the importance of FURS in helping with linkages to ongoing and long-term services in the children's, youth, and families communities, as well as the importance of coordinating with other important people involved in the child or youth's lives, including existing providers, child and family team members, social workers, etc. On this slide, you will see some of the key definitions that are in statute that relate to who must FURS serve. And I'm going to read them and also highlight a few key things to keep in mind. A caregiver is defined as a person responsible for meeting the daily care needs of a current or former foster child or youth, and who is entrusted to provide a loving and supportive environment for the child or youth to promote their healing from trauma. What's important to note here is that the caregiver definition was it's intentionally defined broadly so as not to be limited to a parent or and to include someone acting in a caregiving role at the time that there is some instability. For example, it could also be a child care provider, a CASA, a respite provider, or someone else that may be acting in a caregiving role. Current FURS is available to current or former foster youth, and the definition included in statute includes a child or youth adjudicated a dependent or ward of the court and who is served by a child welfare agency or probation department. It's also inclusive of a child or youth who has exited foster care to reunification, guardianship, or adoption, and is available to both current or former foster youth up until the age of 21. Another important piece of information to keep in mind is that there is no time restriction on when an exit must have occurred for a former foster youth. And for example, A 17-year-old former foster youth who was adopted, reunified, or appointed a legal guardian at 2 years of age can still access FURSZ. By ensuring that this is a resource available to former foster youth, FURSZ can help in reducing the rate of reentry of youth into the foster care system and out of home care by providing the support that is needed. The following are also some additional key definitions that are in statute. I've touched previously on instability. Instability means a situation of emotional tension or interpersonal conflict between a caregiver and a child or youth that may threaten their relationship and may lead to a disruption in the current living situation. As I noted before, instability is broadly defined. It includes situations where there might be tension or conflict. It does not require the child or youth to be a presenting problem or to have a mental health crisis. In fact, a child or youth does not need to meet any clinical criteria for the caregiver, child, or youth to receive phone or in-person support through FURSZ. While noting that that a child, youth, caregiver can receive the support without there being any clinical criteria met, I also want to highlight that FURSZ is also a resource when there is a behavioral health need or mental health crisis. Both of those situations and all along the continuum are included when we talk about situations of instability for which FURSZ support is available. Later on, you'll be hearing more about the mobile response teams and expectations around in-home support. In statute, in-home is defined as the place where the child or youth and caregiver are located, preferably in the home or some other mutually agreeable location. A few things to keep in mind when thinking about in-home is that it can include a location of the child, youth, or caregiver's choosing. It could be somewhere outside of the home, a mall, somewhere else in the community. It is the idea of meeting the family where they want to be met. It's also important to note that eligibility for support through FURSZ is not dependent on the child or youth being in a specific type of placement. FURSZ is available to serve children and youth that may be homeless, that may be missing from an approved placement, and that call in and need support, as well as youth that are in congregate care. Additionally, the in-home response must be provided in the county where the youth is located. For former foster youth, they will not still be under the jurisdiction of a county child welfare agency or probation department. And for those that are still under the jurisdiction of either department, it's critical that they receive the support where they're located, regardless of what their county of jurisdiction is. The definition of mobile response that is in statute is the provision of in-person, flexible, responsive, and supportive services where the caregiver and child or youth are located to provide them with support and prevent the need for a 911 call or law enforcement contact. One thing to note with that is it is different than what the definition may be for mobile crisis response, which may only be available in more narrow situations. At this time, I'm going to transition over to Lori Fuller, who will provide more in-depth information on the statewide hotline and the mobile response components of FURSZ.
Thank you, Jessica. So now we're going to take a few moments to talk a little bit more in depth about the statewide hotline. The statute clearly outlines the requirements for the hotline. It needs to be a service that's available 24/7 to respond to calls from a caregiver or current or former foster youth during those situations of instability that Jessica spent some time talking about. The statewide hotline needs to have staff that are a blend of professionals and paraprofessionals, including but not limited to mental health clinicians, as well as youth and parent peer partners. One thing that is really important to know about that is in developing the FURSZ legislation, they talk to many youth as well as current caregivers, and what they heard is that that's often some component that's missing. They're not able to access folks with lived experience who really know what they're going through, to talk to and help them in those times of instability. Hotline workers must be trained in conflict resolution and de-escalation for children and youth impacted by trauma, and have the capacity to provide mediation, relationship preservation for the caregiver and the child or youth, and do it in a family-centered and developmentally appropriate approach. Additionally, the statewide hotline must maintain contact info for all the county-based mobile response systems so that they can provide referrals to local services. When a call comes in to the statewide hotline, the staff will have access to a system where they're able to verify the eligibility in order to determine if they're a current or former foster youth or caregivers. And all callers will receive phone support through the statewide hotline, even if they're not within the FURSZ eligible population. And this is really important to know that anyone who calls will be talking to, trained staff who have knowledge and information about de-escalation and those sorts of things, as well as resources. And so they will, provide conversation and support to anyone that calls in. However, in order to receive an in-person response, you will need to meet the eligibility requirements. After that hotline has completed their service, they will contact the caregiver and the child or youth within 24 hours after the initial call to offer additional support. The hotline staff will make a referral to the county-based mobile response system for further support and in-person response when needed through what's called a warm handoff, and we'll go over more about that in just a moment. As I said before, the only eligible individuals will be able to be connected to this mobile response system. Also, it's also very important to know that this is an optional part of the service. Children, youth, or caregivers can decline the referral for in-person support. What we've also heard with other counties and systems and states that have FURSZ-like systems is that oftentimes all that is needed is, somebody to talk to. And so by calling the statewide hotline, folks will get that connection. They'll have someone to listen to them, and that may be all that's required, and they won't either want or need an in-person response. CDSS is contracted with Sacramento Children's Home to be the statewide hotline vendor. So they will be operating the hotline, and they are going to be known as the CalFURSZ program. So as we talked about a moment ago, the way that the statewide hotline staff will connect with the counties in order for the caregiver and or youth to receive an in-person response is through the warm handoff. This warm handoff process involves a three-way call. So the statewide hotline staff will keep the caller on the line while they connect in with the county mobile response points of contact. This process will allow for the transfer of key information to avoid a second triage before the in-person support is provided. And that's really important because another problem that happens with some of our youth and families in the child welfare system is they have to tell their story over and over again. And they don't always, feel heard when they have to repeat themselves. So this warm handoff will allow for key information to be provided by the statewide hotline staff and the family and youth to provide additional information if they would like, but they won't have to go through the whole problem and information again. So the statewide hotline contact will share the essential information and identify whether the needed or requested response is urgent or non-urgent. The information provided is just going to be utilized to identify the team members that should be sent out on the response. So depending on the nature of the situation of instability, the mobile response teams will better be able to figure out whether they need a professional, paraprofessional, or youth or parent partner, as we talked about earlier. Another key component of FURSZ is determining whether the family or youth requires an urgent or a non-urgent response. The required timing for an urgent response is within 1 hour, but not to exceed 3 hours if there's some extenuating circumstances. The required timing for non-urgent responses is within 24 hours. So all mobile responses will be considered urgent unless a child, youth, or caregiver requests to schedule a same-day response at a specific time or window of time. This would happen in a situation where the caregiver may want to make sure another family member is able to join them, and so they will ask the mobile response team to come out at a slightly later time, but still within that same 24-hour period. Now I'm going to hand it over to Ricky House, who's going to talk a little bit more in detail about the mobile response system.
Thank you, Lori. So FURSZ legislation requires that county child welfare, probation, and behavioral health agencies establish a joint county mobile response system. It is vital that all three of these agencies coordinate to develop their local mobile response system. And this mobile response system must have a single point of contact for warm handoffs from the statewide hotline to the FURSZ mobile response system. Should also include a family and youth-friendly point of contact. Child Protection Services hotlines or law enforcement should not be used as the point of contact. It's important to note this because we really want to encourage an environment of support, and there's some fear that can be associated with Child Protection Service hotlines and law enforcement agencies. A mobile response system and stabilization team must be available 24/7 and 365 days a year and able to provide immediate, in-person, face-to-face response. Mobile response systems can be implemented on a per county basis or by collaborating with other counties through a regional approach. What we are noticing so far is that most counties are going with a county-based approach, and so we're going to be seeing less of those regional approaches and more of those county-specific local mobile response systems. Mobile response team composition. So this information is provided during a warm handoff from the statewide hotline and should be utilized to identify the most appropriate team members to send out. So when we're thinking about mobile response team composition, it's really important that the statewide hotline information is utilized to identify the best people that would be appropriate to send out on those teams. So mobile response teams in general are multidisciplinary teams and can include licensed clinical social workers. They can include associate level clinicians, case managers, public health nurses, and peer partners, just to name a few. So mobile response team members, it's very important that they receive specialized training. And so it's very vital that we are able to inform and assure our folks that are calling for support that these team members will be specialized in trauma and foster care systems and will be knowledgeable in responding in this specific instance. So peer partners and those with lived experience should play a critical role in the response team whenever possible. Also, of course, it's very vital that these mobile response team members be culturally competent and responsive. Mobile response teams must view the family as a global unit rather than viewing the child as a problem to be solved. It is important that these teams provide supportive services in the least intrusive and most child, youth, and family-friendly manner, such that mobile response and stabilization teams do not trigger or further traumatize the child or youth. And for this reason, the team members should not be police officers or CPS investigators. Similar to what we previously mentioned, it's very important that we're fostering an environment of support and limiting the possibility that fear might be associated with the FURS support. So it's important to remember that FURS mobile response is a different kind of mobile response than any of us or many of us are used to, and that the true goal is trauma-informed support during any situation of instability. So sometimes we have to shift our mindset of our traditional way of thinking about mobile response. Mobile response teams must be able to provide in-home crisis de-escalation, stabilization, and support, including all of the following. So establishing in-person, face-to-face contact with the child or youth and the caregiver, identifying the underlying causes of and the precursors to the situation that led to the instability and led to them reaching out to FURS, identifying the caregiver interventions that were attempted in order to think through different approaches that may be utilized, and also observing the child and caregiver interaction with the goal of providing support. Of course, the mobile response team is being deployed to diffuse the immediate situation and help support in any way possible. And that sometimes will include, or will always include, the coaching and working with the caregiver and the child or youth in order to preserve the family unit, maintain the child and youth in the current living situation, or if necessary, create a healthy transition plan. The provision of in-home crisis de-escalation, stabilization, and support includes all of the following follow-up activities. Establishing connections to other county or community-based supports and services to ensure continuity of care. Following up after the initial face-to-face response for up to 72 hours to determine if additional supports or services are needed. And identifying any additional supports or ongoing stabilization needs for the family, and making a plan for a referral to appropriate supportive services within the county. So it's important that the caregiver and youth and anyone calling the hotline that's eligible for these services be aware that their initial call doesn't have to be the end of their support, and that FURS is there to support throughout the crisis. And that can include up to 72 hours later. And of course, FURS is there, even if that time lapses, they're always able to call back and continue to receive that support. So when we think about mobile response coordination, these teams are expected to coordinate with existing providers and treatment team members, but should not delay or decline to provide immediate in-person support on that basis. So what we mean by that is that we're very aware that there's support already in place, and the goal of FURS is to align with those services and not to contradict those services. But that being said, FURS is there to provide immediate support, and we do not want to withhold any immediate support because we're experiencing barriers in reaching the child and family team or a point person for the child and family team, or if we're struggling to identify or locate the existing behavioral health treatment plan. So with that being said, every mobile response team must have a process for identifying an existing child and family team and coordinating with that child and family team to address the instability and plan for ongoing care. So again, we're wanting to collaborate with the CFT and work with them in order to come up with next steps. And we're also wanting to make sure that every mobile response has a way of identifying any existing behavioral health treatment plan and a placement preservation strategy, and for coordinating response and services consistent with that plan and strategy. So again, I just want to emphasize that FURS is here to align with the existing plans in place, but in the event that we cannot coordinate with those plans prior to going out for mobile response, the goal will be to circle back and connect with those teams, and again, not delaying that immediate response that the mobile response team is able to provide. The mobile response coordination. So mobile response team must communicate with the county of jurisdiction and the county behavioral health agency regarding the service needs of the children or youth and caregiver if the child or youth is currently under the jurisdiction of either the county child welfare or probation system. So as with all of child welfare aspects, it's very important to be having that open communication, especially when we're speaking about different counties that are involved. So the goal here is to have that open communication and be communicating directly with all of the relevant agencies. So to this point, ongoing direct communication between the county of jurisdiction, the county behavioral health agency, and the mobile response team must be made. The summary report is a tool to assist the mobile response teams in communicating with the county of jurisdiction and CDSS. In order to speak more about the summary report, I'm going to pass it off to my colleague, Colin Williams.
Thank you, Ricky. As stated, the summary report is a means of communication, and a key component of FURSZ is the reporting and sharing of data to help arrange the ongoing needs and supports of families that have engaged with the FURSZ program. The summary report will help communicate key information from the mobile response team to the county of jurisdiction when there's an open case and to CDSS for the purposes of a county of jurisdiction to be able to perform ongoing service supports. In developing the summary report, one of the primary reported concerns of youth and families was the need for confidentiality when engaging with this program. Families expressed concern that using FURSZ would be seen as a negative or a parenting weakness, or could result in a child welfare investigation. As stated earlier, these interactions unfortunately are characterized by a fear response that may limit the effectiveness of supportive programs such as FURSZ. To establish FURSZ as a positive resource and to encourage families to engage the program, the summary report is intended only to ensure linkage to ongoing supportive services and is labeled as such on the report. Furthermore, the summary report and any of its content should not be included in case plans or court reports. Again, linking to the previously noted concern of this information being used negatively against families. In structuring the summary report as is helps create a supportive structure to ongoing resources. Following the delivery of a mobile response, the summary report must be completed. The following information is to be collected and is noted on the summary report itself. The date of the response, the time the call was received from the state hotline and the warm handoff was initiated, the time that the mobile response team arrived at the home to provide the service. This is to document adherence to the urgent and non-urgent definitions, the 1 to 3 hours as stated in urgent response priority. The response priority is also noted on the summary report, whether it was an urgent, non-urgent, or if there was no response provided, and reasoning why. The location of the response, including the county that was responding and the county of jurisdiction if different. The responsibility of responding to a call is on the county where the youth, child, or caregiver resides, not necessarily the county of jurisdiction, although in many cases it will be both. The address of the response and the location type of that address. Again, noting, as previously stated, that while described as an in-home support, the definition of home may be broad and may not include the actual residence where the caregiver or youth are residing. The participants involved in the response, the child or youth, or non-minor dependent, caregiver, or other household members who were involved in the response. Their contact information for follow-up purposes, and if interpreter services were needed or provided. The summary report also notes the mobile response team members with their names and roles. This information will possibly assist with follow-up if there's any other needs of the mobile response team to provide ongoing support within that 72-hour window. A brief summary of the presenting issue. This is high-level information and describes what brought about the need or the request for support. This section should contain only high-level information of the circumstances that created the request for a response. In keeping with the concern of families for their confidentiality to be protected, again, this section is not a case note and is not entered in CWS as a case note. For example, this section may state, there was a disagreement between youth and caregiver regarding screen time and it escalated. Youth contacted hotline requesting in-person response. Or caregiver requesting parenting support regarding homework battles. The summary report will also inquire whether the situation was stabilized, and if not, why not. It will prompt a description of the de-escalation, stabilization, and support services that were provided by the mobile response, and strengths and needs that were identified for the family, describing family strengths and outstanding service needs for the purposes of ongoing support. The summary report will also indicate who completed the form, but it does not require a signature. Also included on the summary report are the routing instructions for identifying who to send the summary report to for the county contact for the county of jurisdiction, and also instructions on how to include CDSS as a recipient of the summary report. For further information regarding the completion of the FURSZ summary report, please refer to the FURSZ summary report guide. It will also be found at the website listed below, which is the CDSS FURSZ Information Hub. For further data collection needs, I pass this on to my colleague, Jennifer Snar.
Thank you, Colin. The statewide hotline, or I'm sorry, the FURSZ legislation included a number of data collection requirements, and those include tracking the number of caregivers that have been served through the hotline and sorting those by placement type. In addition, we'll be looking at the status of the caregiver, be it current or former foster caregiver, and then also the number of foster youth served through the hotline, separated by agency type, be it child welfare or probation, and their status as a current or former foster youth, as well as some demographics such as their age, gender, and race. We'll also be collecting some call information. So we will be looking at the disposition of each call, specifically whether or not a mobile response was provided, or if a mobile response was not provided, whether the call was referred for other services. We'll be looking at whether or not the call was initiated by the youth or the caregiver, and taking a look at some county-based outcome data, which is including but not limited to placement stability. So looking at number of placement moves following the mobile response, the return into foster care, especially for our former foster youth, if the youth has moved from the child welfare system to the juvenile justice system, and timeliness to permanency. In the data collection process, we are going to utilize some tools to help with our data collection needs. Specifically, our statewide hotline staff will have access to our CWS CARES snapshot and facility search tools to help obtain basic information about our caller. More specifically, they'll be able to conduct a search through the snapshot tool and determine if that youth is a current or former foster youth, and whether or not they've had an open or a previous open case. They'll use the profile that they identify in snapshot search, which is shown on the right, to identify the client ID, and you can see that indicated at the top of the page. they'll be able to copy and paste that client ID and put it into the report back to the statewide hotline in order to ensure data accuracy. The statewide hotline will initiate a two-way communication from the hotline to the county via email. That will include that client ID that they've copied and pasted from the profile, as well as a link to what has been described as kind of a SurveyMonkey survey. So the counties can just click a few responses to report back to the statewide hotline, and the client ID, as stated before, will be included in this email. Once the county receives the email, they'll see something similar to what you see on the screen, although the screenshot here is not yet updated, and so it is not totally representative of what our counties will be seeing. For instance, the screenshot you see says length of service, but instead what we're actually going to be asking is time to response. So the counties can record whether or not they delivered their response within 1 hour, 1 to 3 hours, or up to 24 hours, or if the mobile response was not provided and why. Once the counties fill out this short form, then they'll be able to click submit and indicate they're not a robot. And that information will then report back to the statewide hotline, and that data will automatically populate into the record in the hotline database. This will complete the data exchange requirement for the county. So we're hoping that that will keep it nice and simple for counties and make it easy for them to maintain an easy data collection connection without having to do a ton of data reporting on their end. The statewide hotline will provide those reports monthly to CDSS data team to utilize for data collection and outcomes analysis. The CDSS data team will utilize that client ID to extract as much information as possible for outcomes measurements and again, reduce those data demands on the counties. Next up, we're going to shift gears a little bit and talk about our outreach efforts for FURSZ. The FURSZ legislation requires CDSS to develop methods and materials for informing all caregivers and current or former foster children or youth about the statewide hotline, including a dissemination plan for those materials, which shall include, at a minimum, making those materials publicly available through the department's internet website. So we have developed a FURSZ webpage, and thanks to our partnership with Sacramento Children's Home, we now have a logo that we can utilize for our materials, as you see on your screen. And the logo includes our phone number. So we're really excited to have that ready to go, and you'll be seeing that on many of our materials. We've also developed some initial flyers. These may change over time, but we wanted to show some examples of some of the work that we've been doing related to publicizing FURSZ. So here's an example of a youth flyer. And on the next screen, you'll see some of the efforts that we made to ensure that this flyer was youth informed. For example, we spoke to some youth and received feedback about what they'd like to see in their publications. And some of the important feedback that they gave us was to make sure that we really emphasize that this is 24-hour and 7-day-a-week support. We wanted to use youth-oriented photos and some improved technology, such as the scan code that you see on our flyer, so they can just scan with their phones, and it'll take them right to the webpage. We asked for some suggestions on language that they'd like to see on their flyers, and we incorporated as many of those phrases, key phrases, into our text on the page, such as emphasizing that FURSZ is a safe, judgment-free, and private space to talk about their worries and vent. We wanted to be inclusive of LGBTQ+ imagery, and we included our Cal FURSZ logo, as you see. But most importantly, we heard loudly from our youth that it would be best to include youth art And so we were very excited to receive a submission of a FURSZ logo that you see in the lower part of our flyer. And that was designed by a foster youth, and we were really happy to be able to start sharing those in some of our youth materials. We also have an example of a caregiver flyer. So on our next page, you'll see a few of the things that we highlighted for that were caregiver informed pieces. For instance, we didn't want to use imagery that suggested blame or fault, like an argument between a caregiver and our youth. We wanted to make sure we included male and female caregivers, and we tried to focus on supportive language that reflects some of the concerns and stated needs of our caregivers when they provided feedback. So speaking of those key messages, there were definitely some important takeaways in some of the conversations that we had with caregivers and youth that we wanted to emphasize and we're hoping to relay to all of you. So when you're talking about the FURSZ program, you can keep some of these things in mind to help share the importance of this program with our caregivers and our youth in their language. So caregivers, when we asked them about FURSZ and what they'd like to see, what messaging they thought we should use, and what was important to them, they really stressed the importance of feeling like they're being supported and listened to. We want them to hear us say that reaching out for help is a sign of strength and not weakness. As you heard Colin mention earlier, that some of our caregivers were concerned that reaching out could be considered a sign of weakness. We want to make sure they're hearing us say that this is a sign of strength. We want our caregivers to hear that we're focused on trying to preserve their relationships and preserve their placements. And FURSZ is intended to support placement, not to disrupt placement whenever possible. These services will assist in a crisis and help avoid some situations of instability, as opposed to some of the current resources that families have to turn to because they don't have a FURSZ-like option in their area. Finally, that FURSZ is not here to take sides, that FURSZ wants to be a neutral party. You see that exact same key message on the youth list because they express the same fear. Both caregivers and youth talked about their fear that whoever they hear on the other end of the line will take the side of the caregiver or the youth and not listen to them. And so we really want our youth and our caregivers to hear that FURSZ will be that neutral party and FURSZ will listen, the staff will listen. For youth, they want to know that support is available. A lot of times our youth talk about feeling alone or feeling lost in the system. And so FURSZ is an opportunity to get that support that may not be available otherwise. As I mentioned previously on the flyer, our youth told us they wanted to know that this is a judgment-free, safe, and private resource. We know that sometimes there will be things that we're mandated to report. Our hotline staff are mandated reporters. We can't guarantee confidentiality in all situations, but we did want them to know that they would be able to have a private conversation with their person on the other end at the hotline, and whenever possible, we will try to maintain confidentiality to the greatest extent possible. We want youth to know that they can call for all things big and small. That was really important from the youth. They wanted to know that it was okay to call when it was something that others might view as small, but is impacting them or potentially leading to escalating to the point of placement disruption. That's something that right now is hard to achieve for youth. A lot of times they're only able to reach out and get help in the most extreme situations. and FURSZ is intended to help provide that support before things reach that point. Our youth wanted to feel heard and understood. Again, sometimes all they need is just a kind listener, as opposed to being shuffled through a number of formal services. So we think that FURSZ will be able to provide some of that for our youth. Next slide, please. All right, so when it comes to dissemination of our materials, we are asking for the help of anyone who might be in county service or work for agencies or organizations that work with families and youth, because we know that as the state, we are providing some materials and doing some statewide dissemination, but some of the most effective methods of reaching families and youth will be at the local level. And so some of the things that have come up in our work groups and that are ideas that our team have had include placing flyers or brochures or information about FURSZ in your placement packets or during a placement exchange or change to talk about FURSZ and share that information with families. Also to include in adoptive placement paperwork or adoption assistance mailers or checks. We would love to see information about FURSZ shared in RFA trainings and to take to families when you're conducting an annual review. It would also be a great idea for the counties that do have dedicated resource family recruiters to engage your recruiters in utilizing FURSZ materials and sharing about FURSZ, because we do believe that FURSZ would be a great retention tool to help families get the support that they haven't been able to find in the past. We know that a lot of counties have their own social media and websites, and so we would love to see counties sharing our FURSZ materials and talking about FURSZ on your social media and websites to help inform counties of this new service. In addition, some of our counties have shared that they're going to reach out to their local law enforcement agencies to talk about FURSZ and educate their local law enforcement about FURSZ, because as we know in the past, because there hasn't been a FURSZ-like resource in many counties, a lot of times if there's an argument or a disagreement between a caregiver and a youth, then the default decision is to call law enforcement. Law enforcement is not really the right method to address some of these situations of instability. And so if they are aware of FURSZ, then they might be able to help divert some of those calls to the right place. We've had of using local libraries, local youth organizations, and community centers and faith-based centers as opportunities to share FURSZ materials as well. Next slide. All right, so I'm going to turn it over to Ricky House to close us out for the day. Thank you so much.
Great, thanks, Jennifer. So in wrapping up, we wanted to share a few resources with everyone. The first being the statewide Hotline CalFURSZ webpage, which provides information on how to call, chat, or text with the FURSZ hotline staff and receive a mobile response if desired. That webpage also includes a link to the CDSS FURSZ webpage. That link is also provided here on that slide. So the CDSS FURSZ policy webpage includes many resources such as the summary report that we just discussed in this webinar. The FURSZ all-county letter is also available, which has a multitude of information about the FURSZ in general. FURSZ legislation is also hyperlinked on that webpage. The CDSS FURSZ webpage also includes tabs for youth resources, FURSZ questions and answers, so technical assistance questions and answers. Previous webinars are posted on that webpage that you can listen to if you so desire. Additionally, we've included some scenarios that FURSZ is appropriate to respond to. So there's a FURSZ scenarios web document on there. Important dates are also listed. FURS implementation quick start guide is available, as well as many other resources. And again, both the CalFURS hotline website and the CDSS FURS webpage are under development. So as we implement this new program, more and more resources are going to be posted on both web pages. The CDSS policy inbox can also be reached at furs@dss.ca.gov. So in closing, we just want to thank you all for being a part of the implementation of this important program. And we want you to know that our team is here to help, and we welcome any questions or comments that you might have. The CDSS FURS team can be reached at that furs@dss.ca.gov email address that you have listed, and we will get back to you within 24 to 48 business hours. So we just want to thank you all for joining us today, and we hope that you have a wonderful rest of your day and your week.